All right, let's go ahead and get started. So welcome to this Introduction to Harmonized Lassi webinar, hosted by the Gateway team at the University of Southern California. If you have any questions throughout, we'll have some time to answer questions at the end of it, and you can ask questions through the webinar, so you can pose them as a question through the question box, or I believe you can raise your hand and we can unmute you and you could ask that question out loud towards the end of the webinar. So to begin with, we're going to hear from Dr. Jin Cook Lee, who will get us started on some background about Lassi.
Thank you, Tristan, and hi everyone. It's very nice to be here this morning to introduce again the Harmonized LASI. So for a very brief introduction of LASI, we did actually organize another webinar earlier this year discussing a little bit more specifics about the LASI study itself. So if you like to know more about LASI, I would like to encourage you to listen to that webinar. But briefly, the LASI is a population aging survey. We developed the panel study to study the aging of the Indian population. And because the goal of the study is providing both scientific evidence basis as well as helping the policymakers to develop a policy. If you look at our instrument, you can actually see a lot of questions are geared toward providing very basic scientific ground for various aspects of aging, ranging from health to economics, but also providing very program-specific questions that will enable both researchers and policymakers to get a sense of how the policies in India have an impact. And another important aspect of this study is it is actually designed very purposefully to enable cross-country analysis with other health and retirement study and its family of studies. So I would like to particularly encourage you to consider cross-country studies with studies like CHARS from China and IFRS in Indonesia, because we have a very good reference of those two surveys when considering the similar settings in Asia. Next slide, please. So briefly, again, the LASI is an ongoing cohort of a study. We recruited more than 72,000 older adults in India at age 45 and older and their spouses. And we have collected data from 2017 to 2019, and we are hoping to follow up these respondents next year for second wave. And data is available through LASI India website as well as the Gateway website. And we do have weights that capture the representativeness. And also you should be note that we have older adults age 45 and older, but also younger spouses if they are married to younger spouses. And this has been translated into 18 different languages, which is also showing in the data set itself which language has been used to answer the questions. And the data set is actually quite complex. So if you are a new user, it will take quite a while to just digest what's in the data. And if you can think about who answered these different modules, I think that's sort of a starting point. So for the LASI study, there are household interview modules, and that includes luster, housing and consumption, and health insurance. This has been answered by an adult at age 18 and older. So it can be on household level informant. And we ask this informant to identify who knows the best about financial information. And then we try to recruit that financial respondents to answer economic measures. But then there could be housing and characteristics about the physical environment. And for that, we also recruit housing respondents. So you should be mindful that the who answered this question could be different for financial sections from the housing sessions, even for the household interview. Then all of this household interview data is, of course, relevant for the individuals who live in the household. And we interview everybody at age 45 and plus and their spouses for individual interviews. And they are also participate in the biomarker measures. So because the survey is long, so you should also look at the item missingness in that aspect. So we start with the interview with the demographics, and as they work through the instrument, and people can get tired and they may drop out, although we do have very high response rate. You can also see the, some of the sample size gets smaller toward the end of the instrument. And another important feature that you need to be mindful about is experimental measure. And for experimental measure, because of the consideration of the length, we actually randomly assign each of the experimental measures to the respondents. So you can see only a quarter of the respondents actually answered one of these measures that you can see in expectations or BNS or time use or social connectedness. Considering the large sample size, it still provides enough power for you to do the analysis, but it's just something that you need to be mindful about. And finally, we do have a community survey, and community survey is conducted at the village level or smaller blocks of the census. And we try to interview people who knows about it. So that means who responded to the community survey would be like the local government officers or those who are panchayats or village leaders. And this community survey is very interesting, providing the environmental level, community level information, and which is unique. But this is also, you can find similar study in or similar measures from CHARS, and Chinese data also provided community survey data. So this is something that you can think about when your research questions, how you would relate to individual level outcomes would be related to household level characteristics, but also within the community, what it would look like at the community level characteristics. All right, this is my brief introduction. So Tristan, I think next will be Hunter.
Yes, yeah, thank you, Jen Cook, for that introduction. Next, Hunter Green is going to tell us some more about the Harmonized LASI dataset itself.
Hello, my name is Hunter Green, and I'm a research programmer at the Gateway to Global Aging Data. Today, I will be providing an introduction to the Harmonized LASI dataset and codebook, as well as a brief walkthrough as to how to access this dataset. If you are unfamiliar with the HRS family of studies, you'll be interested to know that the Lassi sister studies around the world include 45 countries. Also, this list is continually growing, so that's a lot of comparable information collected in different countries. These studies are known as sister studies because they have a lot of similar characteristics to Lassi. They are population representative of older adults. They are longitudinal, so they follow the same person over time. These studies are multidisciplinary, so they are not solely focused on health or economics, but they try to capture many different parts of participants' experiences. They also have enhanced economic data and integrated biomarkers. Finally, the data collected from these studies are publicly available for researchers to use for free anywhere in the world. In the graph on the right, you can see some of the other studies. One of the things we produce for Lassi are harmonized data. Harmonized data are created to provide gateway users with research-ready variables which are comparable between sister studies. These variables are defined as similarly as possible across waves and studies. Each dataset combines all available waves from each study and each individual is identified as one record. So these datasets are called FAT files. In addition, all variables use intuitive variable naming conventions when possible. For example, the harmonized variable R1-MBMI indicates the respondent's BMI value as measured at wave 1. Study-specific variable names are also used to identify interstudy differences. For example, in the Harmonized Lassi, there's a variable called RAEDUC_L, which indicates the respondent's education background. The A in the second character of the variable name identifies that the variable is not specific to a single wave. The _L identifies that there is something specific to the Lassi version of this variable that may be different in other studies. In this case, Lassi uses more lower education categories than the other studies. These differences exist, and they are both a benefit and something to be aware of when planning your analyses. Also, the harmonized datasets include spouse versions of most variables. For example, the variable S1 work indicates whether the respondent's spouse is currently working for pay at wave 1. Finally, all the harmonized variables have been built to account for any survey skip patterns. We've recently released version A of the Harmonized Lassi, and it incorporates all 3 Wave 1 datasets into a single data file. As you can see from this slide, one of the many benefits of using the harmonized data is that instead of dealing with merging different files, you can use one file which has this information already combined. It is important to note that the Harmonized Lassi dataset does not include all of the survey questions that are asked by Lassi. Instead, harmonized datasets focus on survey measures which are most often used or requested by researchers, and which are most comparable between Lassi and its sister studies. Version A of the Harmonized Lassi has 15 sections that you can see listed here. Here's an example of what variable harmonization looks like between studies. If you recall, one of the things I mentioned in a previous slide is that harmonized variables account for survey skip patterns. So we can see a few things happening here. On the left, we have LASI Wave 1, and this is the survey skip pattern inside the Harmonized Lassi. At Wave 1, respondents are asked, have you ever smoked tobacco, such as cigarettes, bidi, cigars, hookahs, or cheroot? Or use smokeless tobacco, such as chewing tobacco, gutka, pan masala, etc. The respondent can answer yes or no, and these responses are coded as 1 and 2 respectively. If the respondent answers yes, then they are asked, what type of tobacco product have you used or consumed? The respondent can answer smoked tobacco, smokeless tobacco, or both smoke and smokeless tobacco, and these responses are coded as 1, 2, and 3 respectively. Let's say we want to make a harmonized variable and we decide to call this variable R1 SmokeEv to indicate whether the respondent has ever smoked as of wave 1. Harmonized variables are always going to have the same value code, so a no will always be coded as a 0 and a yes will always be coded as a 1. In this case, respondents coded as 2 for either Lassi question get coded as 0 in our harmonized variable because these reasons indicate that the respondent has either never used any form of tobacco or they have only used smokeless tobacco. Respondents coded as 1 or 3 in the second Lassi question get coded as 1 in our harmonized variable because these responses indicate the respondent has used smoked tobacco. However, we want to make sure our harmonized variable is comparable between different harmonized datasets. So on the right, we have LASI, which is the Brazilian sister study of Lassi. At Wave 1, LASI respondents are asked, do you currently smoke? The respondent can answer yes daily, yes less than daily, and no, and these responses are coded as 1, 2, and 3 respectively. If the respondent answers no, then they are asked, have you ever smoked in the past? The respondent can answer yes daily, yes less than daily, and no never smoked. And these responses are coded as 1, 2, and 3 respectively. If someone smokes currently, we know they have ever smoked, so respondents coded as 1 and 2 for the first LASI question get coded as 1 in our harmonized variable. Also, we think that those who responded to the second LASI question saying they have smoked in the past are comparable to the Lassi respondents who say they have used smoked tobacco, and those who respond to the second LC question saying they have never smoked are comparable to the Lassi respondents who say they have never used any tobacco or they have only used smokeless tobacco. This example should give you an idea of the advantages of harmonized variables, especially that the value codes are going to be comparable between different harmonized datasets, and the survey skip pattern has been accounted for. One thing that we provide with all harmonized datasets are detailed codebooks. These codebooks introduce the harmonization project and the study itself, and overview survey timing, survey design, and sampling framework. In addition, the codebooks discuss how you might weight your analyses and whether values have been imputed. We detail the specifics of the harmonization process and divide variables into sections based on domain. In the previous slide, we saw the 15 sections of the Harmonized LASI. Inside of the Harmonized codebook, we summarize each set of variables. This is an example of the SmokeEv variable. As you can see, both the respondent and spouse versions of the variables have been created. Another thing you can see is that we have assigned various special missing values to these variables. A special missing value is a way to indicate missingness with some more information, and they are included as part of SAS, STATA, and SPSS. For example, 11 respondents at Wave 1 answered that they do not know to this question, and so we have included that information here. In addition, we also detail the variable creation and any assumptions made in that creation, and we highlight any differences between waves of that study and any differences between this variable and the HRS version of the harmonized variable. We use the HRS as our basis for comparison between all of the different studies. Here, we have some basic information about how SmokeEv variable is constructed. We note that there are no significant cross-wave differences in Lassi in this question, as Lassi has only been fielded one wave. However, we do note a difference with the RAND HRS and Harmonized HRS. This difference is that in the HRS, whether the respondent has ever smoked or not is determined by the following question: have you ever smoked cigarettes? However, Lassi asks whether the respondent has ever smoked tobacco in the form of a cigarette, bidi, cigar, hookah, or cheroot. Depending on what you're researching, that difference might be important for you to be aware of. So while these detailed notes take time for us to write, they can really provide valuable information about the comparability between studies. The last thing we include in the harmonized codebooks is a list of all the variables from the original dataset that we used in the creation of that variable. This information is helpful if you want to go back to the study and look at the questionnaire or the study codebooks and see exactly what variables we used and perhaps why. The Harmonized LASI dataset and codebook are currently available for download on the Gateway to Global Aging Data website. I will briefly walk you through how to access this data. The first step is to visit the Gateway website at g2aging.org and register for access if you have not already done so. The registration process is very quick. You are only asked to provide your name, email address, country, and institutional affiliation. Once you are logged into the Gateway, and select the Downloads Data and Links page at the top of the website, and click on the Program on Global Aging, Health, and Policy link in the Lassi column. The next step is to download the Lassi Data Access Use Agreement, which can be accessed by clicking on the Data Access Use Agreement link. You will be asked to review and sign the agreement. The agreement will also ask you to fill in your name, title, institution, address, telephone number, and email address. Please fill in the same email address that you used when registering for the Gateway website. Once you have filled out the Data Access Use Agreement, click on the Data Agreement Form link. This form will ask you to provide your affiliation type and affiliated institution or organization. Here's where you upload your completed Data Access Use Agreement. The agreement must be submitted in PDF format or it will not be accepted. After submitting the data agreement form, you will see this page letting you know that your application is now pending. Once your application is approved, you will receive an email confirmation from the Gateway team. The link in the email will take you back to the Downloads, Data, and Links page of the Gateway website. Clicking on the Program on Global Aging, Health, and Policy link in the Lassi column will take you to the data. Here you're able to download both the Harmonized LASI dataset and codebook and also the LASI public use data files. The Harmonized LASI dataset is available in Stata, SAS, SPSS, and R formats. The download will also contain Stata creation code so you can see the exact code we used to build this dataset. There are a number of other resources on the gateway around Lassi, and those include the study overview page, survey metadata, concordance tables, interactive graphs and tables, and a publications catalog. I'm going to switch over to the Gateway website and briefly highlight a couple of these resources. From the Gateway to Global Aging Data website at g2aging.org, we can click on Surveys at a Glance, and then on the Core Interview tab, where we can see that we have the Lassi metadata for the Wave 1 Core Interview. If we click on this, we can see that Lassi, like most surveys, are divided into modules with different topics. We can then go into the Household Level Housing and Environment, or HE module. You can see here that we provided a flowchart version for the survey, so we can see easily that depending on how the respondent answered HE001, they're either asked HE002 or they go directly to HE003. You can also look at the module items individually and go into any one of these to find more information. Or you could look at it in a traditional codebook view where we've displayed the question text, answers, and how those answers are coded in the survey. We also have a search feature, so instead of going through the survey manually, you can just search for the topic you're interested in. For example, let's say we're interested in smoking in the Lassi survey. However, we could also choose any of the other surveys. We can see here that we found questions for 2010 and 2018. We found questions for 2010 because that is when the pilot for Lassi was fielded. If we further limit our search to 2018, when LASI Wave 1 was fielded, we can see a smoking-related question we saw earlier, such as, has the respondent ever smoked tobacco or used smokeless tobacco? But we can also see additional questions, such as, does any member of the respondent's household smoke inside the home? And whether the respondent's job requires them to be around burning material, exhaust, or smoke. I'll also mention that we do have a study overview for Lassi, where we've displayed the Lassi sampling frame, data collection, sample, data linkages, and how to access both the raw data and any harmonized datasets that we have produced. We have created many harmonized datasets which are comparable to the Harmonized Lassi. These include the RAND HRS and Harmonized HRS that cover the United States. Briefly, I'll mention that the Harmonized HRS is a supplement to the RAND HRS, so the RAND HRS is the main harmonized data file, and some additional variables that help with cross-country comparability are included in the Harmonized HRS. MHOS covers Mexico, ELSA covers England, SHARE covers most of Europe and Israel, CRALIS covers Costa Rica, CLOSA covers South Korea, JSTAR covers Japan, TILDA covers Ireland, CHARLES covers China, and MARS covers Malaysia. You can go to the Downloads page of the Gateway website to find the links to download the harmonized datasets, harmonized codebook, and data creation code, which are needed to create the CLOSA and SHARE datasets. All of the other harmonized datasets can either be downloaded on the Gateway or at the website of each respective study, depending on the study. On the Downloads page, you can also register for quite a few of the HRS family of studies by clicking on the link in the blue box at the top of the page.
Thanks, Hunter. So for the last part of this webinar today, I'm going to walk you through an example analysis. So we're going to do a small bit of analysis using the Harmonized LASI. And it's helpful just to get an idea of all these advantages that we've talked about Lassi and its cross-study comparability and the ease of data access with the harmonized LASI by doing an analysis. So it's going to be a quick example, but we're going to have two parts. We're going to do some analysis of LASI using the harmonized LASI dataset. And then we're going to do a very short cross-study analysis using variables from the harmonized Lassi and harmonized Charles. And as Jin Cook mentioned, the harmonized Charles, the Charles study is the sister study of Lassi in China. So for the first part of our analysis, we're going to ask ourselves a research question, which is how does the prevalence of disability increase with age? So do we see different levels of disability at different ages? And do we see different patterns for men and women? And do we see different patterns for individuals in urban or rural areas? So a number of ways that we want to look at this question about disability. So to do this analysis, to get started, or to do most analyses, you're going to start with a few basic steps. We're going to download the harmonized LASI dataset. You're going to identify your relevant variables. Switching to Stata, we're going to use Stata for this example today, but the datasets are also distributed in SAS and SPSS and R, so you could do these analysis through this. We're going to then create some additional variables. We'll apply weights. We're going to do a few univariate analyses of disability prevalence and one multivariate analysis of disability prevalence. So as Hunter showed us, you can download the harmonized LASI once you are registered in the gateway and approved for access to the LASI data, and it's available in Stata, SAS, SPSS, and R format. And then you want to identify relevant variables in the harmonized LASI. We're going to be using Wave 1, which was conducted from 2017, 2019. We're going to use the unique identifier of LASI, which is prime key, an indicator of participation in Wave 1, the analysis weight for Wave 1 at the individual level, the respondent's gender, the respondent's age, whether the household is urban or rural. And to model disability, we're going to be looking at ADL difficulty, or ADLs stand for activities of daily living. So these are questions about common activities that we all do day to day, like getting out of a bed, eating. And the questions ask whether the respondent needs help doing this. And so we've created an ADL summary score in a lot of different studies that looks across these 5 ADLs and says how many of them have a difficulty. And that variable is called ADL5. To be able to find these variables, I would suggest you could use the gateway as Hunter showed and go through the search function and find those that way. You could also use the harmonized LASI codebook, which is divided into sections. So there's sections on weights, a section on gender variables, age variables, urbanicity variables, etc. So you can find out more information that way. So the first thing we'll do inside of Stata is we're going to load the harmonized LASI data. So the Stata code for this is we're going to use. And the harmonized LASI is quite a large file. There's a lot of variables, I think more than 10,000 variables in it. So depending on your version of Stata, you might not be able to load all of harmonized LASI at once. But what you can do is load a subset of the harmonized LASI variables. And you can do that by specifying which specific variables you want to use outside of the harmonized, LASI, which is what we've done here. And I'm going to switch briefly over to Stata, as I'll do for a lot of this. So you can see here that we've loaded LASI in, and we've tabbed our indicator of participation at Wave 1, and we can see we've got 72,000 individuals who participated at Wave 1. The harmonized LASI is respondent level data. So each of these observations represents one individual who responded to LASI. We can also see that we've loaded the variables here. We've got our prime key, our weight, our age, gender variable, urbanicity variable, and our 5-item ADL summary score variable. I will also be providing this data code on our website after this. So if you wanted to run this analysis, you could also do that on your own. So once we've loaded the data in, we want to create a few additional variables. As I mentioned, we're going to be looking over age. And instead of just using age by itself, we're going to use some age bands. So we're going to use 5-year age bands. And then also, instead of looking at our summary score of ADL, what we're going to do is we're just going to create, for simplicity, a binary indicator of whether the person has no limitations, so they're able to do all 5 ADLs without any difficulty, or at least some. So at least one of the ADLs, they said they have some difficulty doing it, indicating they might need some help doing that. So if we jump back into Stata, you can see first when we sum our age variable, we've got ages ranging from 18 to 16. And if you remember, Jen Cook told us that the sampling frame for Lassie was 45 and older, but that they included spouses at all ages. So at least we have in a few cases some very young spouses which are included in Lassie. For this analysis, we're going to ignore those younger spouses, and we're going to cut our age variable at 45 and then 5-year age ranges. We can see these here. And we can see that we've got lots of observations for all these groups. We also have a group of basically 80 plus, which is our last category. So that's everyone 80 through our top age of 116 would be included in that top category. And we're just going to ignore all those younger spouses who don't fit the sampling frame for this analysis. We're then going to create our limitation variable, and we can tab that also. So R1 limitation is what I named that. And you can see that we've got almost 10,000 individuals who reported having some ADL limitation. But the majority of the individuals in Lassi, or 86%, don't have any problem doing any of the 5 activities of daily living we've created this variable with. The next thing we're going to do is apply weights. As part of Lassi, we do provide individual level analysis weights that make sure that the Lassi sample, which is meant to be nationally representative, is indeed nationally representative for those ages which are meant to be covered by Lassi. In Stata, we can do that using the SVY set command and then specifying our probability weight. The SVY set command is helpful in Stata because it's going to tell Stata some things about the sampling framework for complex survey design, and it's going to recall it. So we don't have to enter in the weight every additional time that we do a first step. So here, actually, when we get to the point of doing some analysis, so we just want to look at the proportion of individuals who have a limitation, and we can look at it for different age groups. Our first question, of course, was, do we see the prevalence of disability differ by age groups? And we can do that individually by, for instance, typing out SVY so that Stata recalls what we said about the weights in this case, specifying just for the subpopulation where the age category is equal to 45. So that'd be people 45 to 49. And we're going to do the proportion of people having a limitation. And we can do that for 45, 50, 55, so on and so on. You can also save yourself some time here writing code. And instead of specifying all the different categories of R1 age, you can use an option inside of Stata where you specify over and then you over a variable. So inside of Stata, what that's going to do is that's going to give us estimates for all of them individually for all of our age categories. So you can see here, once we write this command, it's going to give us an estimation for not having a limitation and for having a limitation for all of our ages, age categories 45 through 80 plus. So you can see those here. One of the things that you see is that it's quite small for age 45, right? We would estimate that only 6% of individuals at 45 have any difficulty with an ADL, while in our 80 plus age group, it's up to 40%. If we want to look at that graphically, We could look at that in this graph here that I've made. And so you can see we do have kind of a general sloping up here of prevalence of disability. It doesn't look like there's kind of a single jump point between a certain age group, but it looks pretty gradual, this transition, although it looks accelerated, especially in moving from our 75 age group to our 80 plus age group. But we should also remember that 80 plus age group isn't a 5-year age band. So that's going to include people up to that one individual who was 116 at wave 1. As I mentioned, we're also going to look at this over gender. So if we look at it over gender, again, we can just change our command to specify gender in the over option. We can see that we would estimate that 11% of men have a limitation and 16% of women. And we can also look at the confidence intervals and see that it does look like those are probably statistically significantly different. If you look at it graphically, it looks like this. So one of the things that we first see is that it looks like we do see that women have a bit more disability than men here. We could also look at it over urban-rural. Again, this is just one simple change. So instead of RA gender in our over option, we're going to list our urbanicity variable. And we could just look at that graphically. And what we do see is that there does seem to be a difference, right? It does look like people in rural locations do have disability, but it doesn't look like the change is quite as large, as dramatic as some of the changes that we saw by gender, and certainly not by age, right? It's the difference of, if we look back at state, it's the difference of 12 and 14.7. So it's a much smaller difference. And then one of the things we can do is we can kind of look at over different genders and ages at the same time. So one thing that we might think is that we saw that people at older ages have more disability, and that we saw that women have more disability. But could it also just be that, for instance, there's more older women inside of India, and so that's driving this connection? So in our over category here, we can specify over RA gender and our age category variable. And what that's going to do is going to kind of make a cross tab of groups. And then we're going to get quite a number of different groups here, and we can estimate them across men and women. If we want to look at that graphically, we can see here that it's a little bit easier to digest all these data points this way. And one of the things that it looks like is that we do see that at all ages, really, comparing the same ages across gender, that women do have higher levels of disability at the youngest ages and certainly at the oldest ages. We can test that inside of Stata using this post-estimation test that I've written out here for how you do that. In this first test, we're going to compare between men and women in the 45 to 49 category, and then also men and women in the 75 to 79 category. And if we look at that inside of Stata, Stata is going to run an adjusted walled test. And we can see that it does look like those are statistically significantly different for our youngest age category and for our 75 to 79 age category. So it is what was kind of suggested graphically, which that we do see this significant difference for all these ages that we're looking over between men and women. We could also do the same thing by urban rural to see if part of what might be driving the slightly higher level of rural disability is that there could be more older people living in rural areas. Looking at that graphically, it actually doesn't quite pan out the same way. So it looks like, especially for our oldest age group, it looks like exactly similar between urban and rural. But what we see is for our younger age groups, there actually looks like slightly higher levels of disability in the rural areas, which might be driving that, that overall slight difference that we saw between urban and rural. And the last thing that we could do is we can kind of combine a lot of these different pieces into a single logistic regression. This is our multivariate analysis, where we're going to look at the whether the person has a limitation by gender, by their urbanicity, and by those age categories. And so if we do that inside of Stata, we can see our results here. We can see that we do estimate, controlling for other categories, that women do have higher levels of these. We've provided odds ratios here. So it's they're 50% more likely that they're going to have an ADL difficulty limitation versus men, and that's statistically significantly. And again, we do see that there is a slight likelihood that they are going to also have a higher level of disability in rural areas, and that is statistically significantly different. And then compared to our younger age group, what we do see is really strong effects, right? So these really strong effects by age, which are, of course, all statistically significantly different. So even controlling for each of these different characteristics independently, we still see this difference happening by gender, by urbanicity, and by age category. So for this quick second part, basically, we're going to do the same analysis, but we're going to include China, so the Charles study also. So we're going to look at, are these same patterns that we just observed inside of India using the Lassi data, are they similar to what we see in China using the Charles data? And because we're using the harmonized Charles, we're going to have variables that are really defined really similarly. They're going to be named similarly, encoded similarly to those variables we've already used in Harmonized LASI. So first we can download the Harmonized Charles dataset. We can identify relevant variables. We're going to create what's called a pooled dataset with observations from both the Harmonized LASI and Harmonized Charles. We're going to prepare some variables. We'll apply weights. We'll do a cross-study univariate analyses, and then we'll do a cross-study multivariate analysis. You can download Charles quite easily from the Charles data page. I've included the link here. You can also find the link, as Hunter showed you, from the downloads page of the gateway. And once you're registered on Charles, which is instant, you just need to request access for the Harmonized Charles data, which is also quite quick usually. We can identify our relevant variables. I would suggest, again, doing this using the gateway search function or the Harmonized Charles codebook itself. And we can see that our variables that we're going to identify are going to be named really similarly. So if we look at our indicator of wave 4 participation, that's going to be INW4. If you recall, it was INW1 for wave 1 of Lassi. We've picked wave 4 of Charles here because that was conducted in 2018. And so that's most similar to the time when Lassi was also conducted. They're both conducted in 2018, although Lassi had some interviews in 2017 and 2019 also. Our gender variable is the same name, same here. Age variable, our rural variable. And we have that 5-item ADL summary score, ADL5, which has the same name also because it's made of the same 5 ADL questions that were also asked in Charles as they were in Lassi. So we're going to create a pooled data set with variables from both. So the first thing that we're going to do is we're just going to save the Lassi data set that we've been working with currently. We're just going to save it and we'll clear out our memory. And then we're going to use the new variables from the Harmonized Charles. This order of commands is helpful because in case you have a specific version of Stata, depending on your version, you might not be able to load the whole Harmonized Charles because it's a fat file. It's a longitudinal data set, so it has a lot of different variables for the 4 waves of Charles that we currently have included in version D of the Harmonized Charles. So once we load those in, we can then append that saved Lassi file. What append does is that append is going to take all the observations from the appending data set and put them below. So this is why it's called a pooled data set. So we're going to have observations representing both studies here inside of Stata at the same time, and it's going to pull in these variables. In the case that the variables overlap each other, like for instance, RA gender is a variable that we have in both, the values for both of those will appear in that same variable. And then we can also use a kind of this append flag that we made here just to indicate whether the individuals are from China or from India. Of course, we want to keep those separate so we remember which individuals represent which studies. If we tab that country variable that we made, we can see that we have 25,000 people from the Chinese study, and again, our 72,000 from the Indian study. In the case of the Chinese study, that doesn't mean that we have 25,000 people who were part of wave 4. The Harmonized Charles dataset has any individual who was part of the Harmonized Charles over all 4 waves of the Harmonized Charles. So probably not all of them are in wave 4. The next step, we can create some additional variables from our Harmonized Charles. This is exactly the same things that we did before. So we're going to create our age categorical variable. We're going to create our limitation variable. And in the next step, we're just going to give these variables the same names. So far, we've been using variables which have the wave number. We've been using wave 1 for Lassie, wave 4 for Charles. And instead, I'm going to change these to be year specific. So we're just going to call them 2018 for all these variables. And we're going to combine them together. So if you can see in this first variable I made, our 2018 age category, we're going to take the R4 age categorical variable from people who are part of the Charles study, and the R1 age categorical variable values from people who are from the Lassi study. And we'll combine those together so we have a combined variable. So we'll do that for age category, for our rural variable. We'll do that for our limitation variable, and we'll do that for our weight variable. So I'm going to jump through Stata, and we'll just make sure we've created all of those variables. That's great. And then the next step is we're going to apply weights. So we're going to do a pooled analysis also. So we're going to be asking Stata to produce estimates for both India and China in the same step. So we're going to use our pooled weight variable here, R 2018 WTRESP. And the important thing here is that we tell Stata that these 2 weights are separate from each other. And so we can do that using the country variable that we identified. So we can specify a stratum of country, meaning that we have one country, one set of values that represent India and one represents China. So that's how you do a pool analysis. And if we jump back in Stata, we can do that. And we can see our weight here, and we've specified our strata. So in the first step, we could just look at our level of limitation between the 2 different countries. So we're not going to look quite yet at age at all, or gender, or any of those other variables, but just country. And if we do that inside of Stata here, we can see that it looks like we have about 17% of people who have a limitation in China for these age groups, and 14% for India. We can look at that graphically. One thing that we want to also remember is that both China and the Charles study and the Lassi study both start at age 45. So they have a really similar sampling frame. That's not true for all studies. For instance, the HRS in the United States starts at age 51. The ELSA and the SHARE studies, that's England and Europe, they start at age 50. So it is important when doing this type of analysis to make sure that especially when we're looking at something like disability that we know is heavily influenced by age, that we are comparing similar age groups. But for the sampling frame for Lassie and Charles are similar enough here that we can look. And of course, graphically, what we see is that it does look like India has a slightly lower level of disability prevalence, although again, it's quite a small difference. The next step is we could look at it over country and age level. So one thing we might also be seeing is that India could have some older people. We know it's highly related to ages. So we could look over country and ages together. If we do that in Stata, of course, we're going to get estimates for our age groups all in China and in India. And if we look at that graphically, we can see that here. And one of the things we also see is the age gradient kind of looks slightly differently. So in that oldest age group of 80 plus, they look like it's a both kind of 40% across both countries. But we really do see some differences for lower levels or lower ages in particular, where it looks like, especially kind of these like middle ages, that China does have higher levels of disability at some of these middle ages, where India has lower ones. So we do see some interesting trends there, looking at prevalence of disability by age in those two different countries. And then for our final step, we can kind of combine everything in a bit of multivariate analysis. And what we're going to do is we're going to do another logistic regression of whether someone has a limitation. And we can do this using some code here, where we're going to look across country and gender, where we're going to control for an overall gender effect, and then the effect of being a female versus one country versus the other, and the same for urbanicity, and the same for our age categories. And so if we do this inside of Stata, our result code is going to be a little long, but we can kind of walk through this. So one thing is that we see, just looking at gender overall, we do see a difference in our odds ratio here, where we have an increase of, we would expect higher odds in India for having it, which is interesting because we didn't see that overall. Also for women, overall, we see women versus men. We do expect a higher level likelihood of having a limitation, and that would be expected. That's consistent with what we saw before. Then if we look at being a woman in India, we don't see kind of a strong or significant difference between being a woman in China. So maybe the gender difference is similar between those two countries, although it is significant overall. For urbanicity, we do see people in rural areas have a higher level across both studies. And we do see that actually, interestingly, there is a lower level, that difference is going to be lower for rural people in India versus rural people inside of China across the two. So what it's suggesting there is that there's more of an urban-rural divide inside of China than there might be inside of India. That kind of disparity, it might be stronger in urbanicity in China versus India. We can look at our overall age categories, which of course we expect to be highly significant, as we've seen throughout, and they're important. And then we can look at whether we see some differences between the age gradients of China and India. And what we see for most of these is that they're not statistically significantly different. So we don't expect the aging process to be too different for these different age categories. So hopefully in this example, we've just kind of outlined some of the interesting things you can do quite easily using these harmonized variables and harmonized data sets. Of course, it's a lot of work to understand one of these studies. As Jin Cook mentioned at the beginning, there's lots of parts of Lassi. And there's a lot of, as Hunter mentioned, there's a lot of different pieces of data which are put together to make the harmonized data set. And so particularly, we build these harmonized data sets and produce the work of the gateway because we really want to facilitate the interesting work that people are able to do once they're able to compare these values and measures across country and look at these kind of significant differences and start to think about why. So thank you for joining us. We're going to spend some time now answering questions and comments. We also, I'll mention though, before we open the floor, that we have a help desk. It's help@g2aging.org. This is a help desk that goes out to our whole team. So if you have questions on any of the harmonized data sets that we produce, or getting access to them, or you're having trouble finding a variable, or you're wondering why you can't find a comparable variable, you can email us and our team will always try to get back within 24 hours. Now, we'd like to hear from researchers about what kind of interesting analyses you're doing with the data sets themselves. We also have the past webinars on our documentation tab. The recording from this webinar, as well as the data code and all of our slides, will be available there by tomorrow, by the end of the day tomorrow. And we also have blogs on our website, including we have a blog both about introducing Lassi, if there's some things that you would like to know about the Lassi study before, or about the Harmonized LASI. Our most recent blog is introducing the Harmonized LASI dataset in conjunction with this webinar. So thank you for spending time with us. And we'll have a little bit of time now to answer any questions that people could have. Let's see, I see one here in the chat from Primula. Glad to be part of the interesting presentation. I'm trying my hand on the Lassi data. So that is great to hear. And then we also have